Let's jump right in. So, as Kurt mentioned, my topic today is about ketamine, something near and dear to my heart, and a new way to change your mind. A couple of disclosures before we begin. I am the founder and medical director of Reset Ketamine in Palm Springs, and this is a discussion of ketamine for off-label use for mood disorders. And by off-label, I mean it's not FDA approved for this certain indication. And we're going to jump into later the history behind that as well. The objectives for today's presentation. First, we're going to review the current state of mental health. We are going to discuss the history of ketamine, review the scientific evidence behind ketamine, in particular for depression, anxiety, suicidal ideation, PTSD, review the mechanism of action, how ketamine works, and then our unique approach to ketamine treatments. So my background is in emergency medicine, and allopathic traditional Western medicine is amazing. So if you're having chest pain, if you're in a car accident, if there's a stroke, you definitely want to go to the emergency room and get seen and evaluated by a physician. But there are some things that we can improve on in modern allopathic medicine. And one particular arena is mental health. 1 in 4 adults suffer from a mental illness. And if it's not you, then it's probably someone very close to you. And if you're not aware of it, they just may not be sharing it with you. So it's impacting quite a bit of our population. One of the big ones that you're probably familiar with is depression. And depression, according to the World Health Organization, surpasses HIV, AIDS, malaria, diabetes, war as the leading cause of disability worldwide. 16.2 million Americans are affected by depression, and it's much more common in females more than males, about 8.5% versus 4.8%. Some studies are also showing that up to 20% of teenagers experience depression before reaching adulthood. In general, there's an increasing prevalence of depression in both teenagers and adults. The biggest concern of depression is that it can lead to suicide, and that can be very, very serious. I want to shift over to anxiety. Anxiety is very common. It affects up to 31% of Americans. They will have an experience or an episode of it at least once in their lifetime. Nearly 2/3 of Americans are anxious or extremely anxious about their health and safety. There's been an increase of more than 1/3 in the general anxiety overall compared to last year. PTSD, post-traumatic stress disorder, affects 3.6% of the US adults. And it's not only veterans. Typically we think about like the Vietnam War or these other international conflicts, but it's actually much more common in females, 5.2% versus 1.8%, and a lot of it stems from interpersonal violence. The lifetime prevalence of PTSD is about 6.8%. Now, we have this global pandemic here, the COVID-19, and that is absolutely affecting our mental health. There's increased loneliness, there's increased isolation, there's more fear of not just, yourself catching COVID, but our friends, our family members. There's economic uncertainties, employment uncertainties, and accordingly, there's increasing rates of depression, increasing rates of anxiety, increasing rates of substance abuse. One news report shows that US cases of depression have tripled during the COVID-19 pandemic, that there is reports of mental health worsening 360% since the COVID-19 pandemic. And traditionally, our options for this are to use SSRIs, selective serotonin reuptake inhibitors. Unfortunately, it's only effective in about 1 out of 3 patients. It can take weeks to months to actually take effect, and it has a lot of side effects, such as loss of libido, weight gain, insomnia, anorgasmia, suicidal ideation, suicidal thoughts. So we need a shift. We need another option. And this is where ketamine comes in. And let's discuss the history of ketamine. Ketamine was invented in 1962. A organic chemist, Dr. Calvin L. Stevens, invented this. He was consulting for the Parke-Davis Pharmaceutical Company. Parke-Davis was working on general anesthetics, and the original one was called phencyclidine. It's also known as PCP. Unfortunately, phencyclidine had a lot of side effects. So they asked Dr. Stevens, hey, can you make a safer anesthetic? And he eventually did come up with one, CI 581. Later, it was renamed ketamine because of the 2 chemical structures that you can see in the middle, which is a ketone group and an amine group. Ketamine was first used in humans in 1964. Dr. Edward Domino, he tested this drug at Jackson Prison in Michigan. So 20 inmates volunteered, and they received steadily increasing doses of ketamine. And what they were describing were these hallucinations, these dreamlike states. They said, quote, I feel spaced out, or I'm floating. And as the dose of ketamine was progressively increased, it was found to be a very effective anesthetic. And they called it a dissociative anesthetic because ketamine seems to dissociate the mind from the body, which is great when you're doing various procedures because it allows the patient to be disconnected if we're, doing something that could cause, discomfort to the body. Park Davis Pharmaceutical, they applied for the FDA approval and they got it in 1970. And the FDA said, hey, it's approved. You can use it for anesthesia in children, adults, elderly during surgical and diagnostic procedures. Once it became approved, and this is in 1970, and this is when the Vietnam War was going on, and ketamine actually became the most widely used battlefield anesthetic, sedative, and analgesic agent because the combat medics would be able to give it to their fellow soldier and it would preserve their respiration so they'd be able to breathe on their own. They would be able to get effective pain relief and they would be able to walk back to the helicopter or to the medical station that they needed to be at, compared to other medicines like opioids, which would make them significantly more drowsy and less mobile. So since 1970, it was used for extensively by anesthesiology in the operating room, mainly for these, procedures for 20 years. And then in 1990, there was a landmark article published in the Annals of Emergency Medicine. And the research was done at Loma Linda University, which is where I trained. And after this study was published, it became much more common to be used in the emergency department setting. So ketamine has been used on humans since 1970, so over 50 years. And it is actually on the list of essential medicines by the World Health Organization. But for a medicine to be on the list of essential medicines means that it's critical for any hospital to have this drug available because of its safety and efficacy. So we're going to shift gears and talk about some of the scientific articles. So let's jump to depression. This article was titled Antidepressant Effects of Ketamine in Depressed Patients. It was the first depression and ketamine study published in 2000, Society of Biological Psychiatry. It was a very small sample size, just 7 patients who had depression. But what was unique about it was that it was placebo-controlled and double-blinded, meaning that both the researcher and the subject, they don't know what they're receiving. And if you look at this graph here, this is the black line represents the ketamine, and with the black circles and the open circles represents the placebo. If you look on the y-axis, you'll see the change in the Hamilton Depression Rating Scale, which is simply just a marker for depression. And what you'll notice is that the patients who received ketamine, their depression scores dropped significantly compared to the placebo. Next, we have suicide. There was another study. It was ketamine for the rapid reduction of suicidal thoughts in major depression. And again, this was a midazolam-controlled randomized clinical trial. And midazolam is a placebo, but it's not just saline. It actually does have some effect. And it makes it a good placebo because the patient will still feel something. And in this study, it was published fairly recently, just 3 years ago. They took 54 patients at a psychiatric unit. It was double blinded, and the patients received 0.5 milligrams of kilograms of IV ketamine versus low dose midazolam. And basically, they were looking at the scale for suicidal ideation. The patients who were initially in the placebo group, if they didn't have an improvement, they were switched to the ketamine. And so you'll notice 3 lines here. You have the green line, which is the placebo. Then you have the red line, which is the ketamine group. And then you have the orange line, which is the people who initially received placebo, but then later they switched over to ketamine because of the efficacy. And so basically here, this is showing that the mean change in the suicidal scores dropped significantly compared to placebo. And not just, not just one day out, but, week 1, week 2, week 3, week 4, week 5, week 6. And now let's look at anxiety. And there was this study was ketamine's dose-related effects on anxiety symptoms in patients with treatment-refractory anxiety disorders. So patients who've tried multiple medications for anxiety, it's not effective, then they switched over to ketamine. And what they found in this study, which was published 3 years ago, was that it was, again, a small study, only 12 patients. But what they found was that out of these 12 patients who either had generalized anxiety disorder, social anxiety disorder, or panic disorder, who had tried previously antidepressants and psychotherapy, they were given various ranges of ketamine, various doses. And overall, 10 out of those 12 patients, so 83%, reported a greater than 50% reduction in the Hamilton A score or their FQ score, which is a fear questionnaire, when they received zero point 0.5 or 1 milligram per kilogram doses. And these effects were, lasted 3 days, 7 days after each dose. And the higher the dose, the greater the effect and duration. Next, we have PTSD. And this study was published in JAMA Psychiatry, and it's the efficacy of intravenous ketamine for the treatment of chronic PTSD. It was just a single infusion. They took 41 patients. Again, it was randomized, it was controlled, looking at ketamine versus midazolam, which is the placebo. Just to let you know, for the non-scientists, when you have a randomized controlled trial, that's really good data and really good evidence to test whether it's different compared to the placebo. And in this study, the graph here is looking at the score of the PTSD, basically. And what you'll notice here with the squares versus the triangles is that ketamine, there was a significant reduction in the PTSD scores compared to the midazolam. And it was statistically significant in this study. Not only, and this is just one infusion, but they're looking at day 1, day 2, day 3, and day 7. So you might be wondering, how does ketamine work? Ketamine, what we know about that is it's working on the glutamate neurotransmitters. And classically, the SSRIs, they work on serotonin, which is a different neurotransmitter. And ketamine goes in and it blocks, there's a receptor in your central nervous system, both the brain and the spinal cord. It's called the N-methyl D-aspartate receptor. Ketamine will go in there and actually prevent the NMDA receptor from being activated by glutamate. And this is what we hypothesize is what causes the analgesic and anesthetic effects. So when you stop the stimulation of the NMDA receptor by glutamate, this is a complex illustration, but the bottom line is that it's going to increase a protein called brain-derived neurotrophic factor, protein synthesis, synaptic strength, and synaptogenesis. And so synapses refers to the connections between neurons. What's happening here is in chronic stress, and what that could be, with depression or chronic pain. If you'll notice in this graph, you'll see that this is a model of neurons. And if you look at the top A and B compared to C and D, what happens is that 24 hours after ketamine administration, ketamine reverses the chronic stress-induced structural deficits. And so I almost, sometimes I tell my patients, it's kind of like giving Miracle-Gro or fertilizer to a plant, and that it's, you got these trees, the branches are kind of withering or, just less leaves. And ketamine seems to act as, fertilizer to help regenerate some of these connections. So bottom line is there's neuroplasticity. And I like this image of the clay because, when someone gets stuck in these chronic ways of thinking, it's like hardened clay. And the way to change that clay is to heat it up. And if you're able to heat it up, then you can make it malleable. And ketamine seems to make the brain more malleable. Also, there's something called the default mode network. And the default mode network refers to this concept of certain portions of your brain that are active when you're doing nothing, when you're daydreaming, when you're resting, when you're not engaged in tasks, just kind of, your mind is wandering. And these portions of the brain seem to light up. And the DMN is related to self-reflection, rumination, self-criticism, and worrying. And we believe that the default mode network plays a significant role in, depression, PTSD, schizophrenia, autism, and chronic pain. What's interesting about ketamine is that it temporarily disrupts activity of the default mode network and the relationship of the default mode network to the other portions of the brain. Bottom line is that it allows the brain to come up with other alternative rest state activities. So, you might, if someone has a habitual self-defeating thought, ketamine could allow you to put in new thoughts. It could allow you to, let these beliefs like, hey, I'm not good enough, or, I'm not loved, or people don't like me, that just kind of run in the background. And if we can, give your brain a reprieve from that, it can be incredibly powerful. So you can put in some new beliefs. Ketamine is very safe, but it does have side effects. It has its pros and its cons, and I want to discuss some of those. There's something called emergence phenomena, which is kind of like a panic attack and just a lot of fear that can occur in 10 to 20% of adult patients after ketamine for procedural sedation. And that's specifically in the operating room and the emergency room. Also, so there's something called laryngospasm, which can happen, very dangerous in that the vocal cords can actually just close up and just shut tight. There's agitation, nausea, vomiting, elevated blood pressure, and pulse. Ketamine is, yeah, it can have some side effects, and be really aware of what those are. In addition, someone had mentioned, ketamine has a really interesting history. It's known to be a drug of recreational abuse. They might call it Special K, Kit Kat, vitamin K. People may talk about going into a ketamine hole, a K hole. So I want to acknowledge that that exists. And one study reports annual use to be, less than 1.7% in young adults. The important thing about ketamine usage is the set and setting. So this is the context of how one receives ketamine treatments. So it's going to be very different if someone is getting it in a clinical setting with, a trained physician there versus they're at Coachella Music Festival, getting ketamine in a different way. In addition, the mindset is referring to the person's intentions and what their state of being is as they're receiving the ketamine. I bring up this graph here because on the y-axis, you have the dependence potential. So the likelihood of getting addicted or, depending upon it, as well on the y-axis, or excuse me, the x-axis, the bottom, you have, how dangerous is it, the active dose over the lethal dose. So you can see ketamine here. It's, you have the very high. So there's, heroin, morphine, nicotine high, cocaine, alcohol, caffeine. So ketamine is in the lower dependence potential section, so it's possible, but the likelihood of that is low. And in addition, as far as like the active dose over lethal dose, yeah, it can be dangerous at certain points. So it's really important to be receiving the ketamine under physician supervision. So ketamine, there are some contraindications. So if someone has uncontrolled high blood pressure, if someone has unstable heart disease, untreated thyroid disease, substance abuse, mania, schizophrenia, previous adverse reaction to ketamine, they probably not a good candidate for ketamine. Before someone receives ketamine with us in Palm Springs, we screen them very carefully, look at their medical records prior to doing any ketamine treatments. Let's talk about, I want to shift into, what we do, what makes us different in our approach. Let's talk about what health means. And I love the definition from the World Health Organization. And they say health is a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. And this is where I apply the biopsychosocial spiritual model of medicine. When we see a human being, they consist of more than just, cells and tissues and organ systems. So we have to consider that when we're treating a patient, but also the psychology of a patient. What's going on in the conscious, unconscious mind? What about their life experiences? What kind of behaviors are going on? In addition, social factors play a huge role. Relationship with your partner, friends, community, society, and earth. And then lastly, we don't really talk a lot about this in the medical world, but the spiritual component of a human being. And this is, the things that are immeasurable. The example that comes up for me is like when we have a patient or when you have someone who passes away, and if you weigh them before they pass away and you weigh them right after they pass away, they're going to weigh exactly the same amount. However, we know that there's something that has changed. You and I both know that. And that's what I'm referring to when I'm talking about that spiritual component, the immeasurable part of a human being. So yeah, I just want to reiterate that when we're, thinking about these various mood disorders, depression, anxiety, PTSD, that, someone might say, oh, it's all just in the mind, or, oh, don't let it affect you, but it's all connected, mind, body, spirit, it's all connected. And the example that I like to use is if you think about, maps. There's on this slide, you have a picture of Arizona. It's a really clearly defined state border. But when you actually go to that border between Arizona and California, there is no, red line. It's all the same. And similarly, that applies to the mind, body, and spirit of a human being. It's all the same. It's all connected. At Reset Ketamine, we have 4 phases of the ketamine treatments. It's not just ketamine. That's one component of it. So prior to receiving ketamine infusions, we have patients prepare their mind for it. So we have some guidelines that we recommend. In addition, we're very intentional about receiving the ketamine. And so I'll ask my patients, what's your goal? What's the intention for this treatment? And third is the experience of the ketamine. We want the patient to experience the experience. And then lastly is the integration phase where, you're going to gain some insights or some lessons or some things that, that just, needs to be changed, or, some habits possibly. And so that's like doing the homework based upon the ketamine treatments. So logistically, here's how we do it. For mood disorders, we do 40-minute infusions. They're typically 6 treatments spread over a 2 to 4 week time period. And then some patients get booster infusions, and that can range anywhere from 3 weeks to 3 months. There are some patients who are non-responders, about 17% get no relief from ketamine treatments, and we usually know after 4 to 5 treatments. And the other thing to consider, because it's considered off-label, meaning it's used for a different indication, that it's not covered by health insurance companies at this time. Our paradigm, we really blend, Eastern, Western philosophies. When I think about ketamine treatments, I think about it more as a catalyst for transformation. We incorporate music, scents, rituals, and having a holistic approach to healing. So to conclude, under medical supervision, ketamine is a safe medicine. It's been used for over 50 years. How it works is via an NMDA receptor antagonist. It increases brain-derived neurotrophic factor, disrupts the default mode network, and allows for increased neuroplasticity. Ketamine can be rapidly effective in treatment-resistant depression, anxiety, PTSD, suicidal ideation. Some of the limitations are that there's no long-term studies, 5 years, 10 years, 20 years out. There is an abuse potential for ketamine, although it's low. It's not covered by insurance, and there are some side effects to be aware of. Lastly, ketamine can be a catalyst for transformation, but it's not a panacea. It's only one part of the solution for these various mood disorders. And these are my references. And what I will do is I'm going to give you my email. So if you're curious about getting the references or getting the slides, you can feel free to reach out to me at info@resetketamine.com. And you can also check out our website, www.resetketamine.com.